Hi, I'm Chip Larson, Director of Capital Physical Therapy. I'm excited today to present the Functional Movement Screen, or FMS for short. This is a series of 7 tests designed to look at functional movement patterns that we do on an everyday basis, especially with athletics. What we're looking for here is to try to find asymmetries, deficiencies in body movements, and the whole idea is really to try to enhance athletic performance and also to minimize the risk of injury. So in a nutshell, we're looking for a weak link. Today you'll see me take an athlete through those series of 7 tests, and I'm looking for asymmetries, problems with the movements, ultimately to try to clean up his athletic performance, and just like I said, minimize his risk of injury. So it's something I'm very excited to be able to offer here locally. I think it's going to be an essential part of risk or injury minimization, and I'm really excited to bring it to Concord. So the first test in our series is called the deep squat, and this is going to be a test testing total body mechanics, neuromuscular control, basically coordinated movements between the pelvis, the core, upper extremities, and lower extremities. I'm here today with my friend and accomplished triathlete Sean Snow, 15-time Ironman finisher. We're going to demonstrate the deep squat here. I'm going to run Sean through it and try to point out what we're looking for as he does the test. So Sean, here's your pole. So what we're looking for is Sean's going to press the stick as far overhead as he can. The instructions are pretty simple. I'm going to ask him to keep his head facing forward, chest forward, and simply to squat as deeply as he can while trying to keep that stick pressed overhead. So whenever you're ready, Sean, let's try the first trial. Very good, and come on up. So that was actually a pretty good test right there, but what I did see was he wasn't quite able to bring his thighs below a level parallel with the floor. So a simple compensation we're going to make now is we're going to try to help him out, try to clean up the movement a little bit by simply having him step back. His heels are going to be placed on the board, which is right behind him, and we're going to do the same movement. So same instructions. Sean's going to press the stick overhead, head and chest are up. He's going to squat as deeply as he can while holding that stick as high overhead as he can. Very good. So now what I'm seeing is he's able to keep his trunk more upright. His thighs are below parallel. The stick is overhead. Come on up, Sean. Generally, he's able to keep better alignment by having that board brought into play. So I'm going to sneak around, just observe from the front. We're going to go with one more trial. I'm looking for good alignment between his knees, his ankles, his hips. Shoulders are high overhead, arms reaching overhead. Good, and come on up. So I would score that. The FMS system has a grading criteria of scores 0 to 3. Sean didn't get any pain doing those tests. I'm going to score him at a 2, which is average, and average is actually a good score for this test. I didn't find any asymmetries. As soon as we moved that board into place under his heels, he was able to clean up his movement and maintain good alignment while doing the deep squat. So our next test is the hurdle step. This is an important test to test the body's ability to accelerate. As you might imagine, important for any running athletics, any athletics that require the athlete to quickly accelerate or change direction. It's also an important test for basic stepping functions of the human body. So as I take Sean through this test, we're going to look for alignment. Excessive movement of his upper body or his torso could be seen as a compensation. So basically the hurdle step is really looking at a primitive movement pattern of stepping, something that's essential for virtually all athletic endeavors. So Sean is simply going to step up to the board. His toes are against the board. The instructions are pretty simple here. I'm trying to keep him maintaining proper alignment as he simply raises one leg at a time over the hurdle, taps his heel on the ground on the other side, and tries to return to the starting position while maintaining his balance as best he can. So we're going to go ahead, Sean. Well, let's start with your left leg. You're simply going to step over the hurdle and try to return to that position while keeping your body upright as best you can. Good, so there's one trial. What I'm seeing so far is it's a good pattern, but he's not able to keep good alignment between his hip and his pelvis, and his knee rather, so we're going to give him a second shot at it. Let's do the same thing, Sean, with your left leg. Trying to step over. Pretty good. His upper body is relatively quiet, which is good. Again, that last little part where he's coming back over the hurdle, a little bit of asymmetry, a little body lean. So we're going to give one more trial on that left side. And minor loss of balance, that's okay. All right, so we've gone and tested the left side. We're going to do the same test on the right side, and what we're looking for are any asymmetries. Can he do it better on one side than the other? So when you're ready, Sean, right leg. Very good. If you notice there, so far he's able to keep better alignment of that right lower extremity as he does the movement. A little bit of an asymmetry, but we'll give him 2 more tries on the right leg. Very good. Again, I'm seeing good symmetry there, so we're going to go ahead and stop the test at that point. Basically what this highlighted for me was a minor asymmetry. His left leg was not able to keep great alignment. You know, again, not terrible, but something that may pop up and may, you know, cause a movement pattern deficiency with some of his athletics. Especially we know as a triathlete he's got to do a lot of running, so stepping functions are going to be real important for Sean. So this will be something that he'd require some corrective exercise to try to clean up this movement pattern. Again, we're trying to help him out athletically and trying to minimize the risk of injury here. So our next test is the inline lunge. In contrast to the hurdle step, now we're testing the body's ability to decelerate movement. So this is a very important functional movement pattern for any sport requiring deceleration or changes in direction, rapid changes in direction. It's also going to test core stability, balance. You can see he's got a narrow base of support. It's going to test hip mobility, ankle mobility, all in one. So there's a lot of things going on here throughout this movement. Basically what I'm looking for is Sean's going to slowly basically do a split squat toward the board here, and he's trying to maintain good alignment. He's trying to keep that stick in contact with his spine. He's going to start with his left heel on the board. He's going to go down, touch his left knee to the board, stand back up and try to return that heel to the same starting position while maintaining good alignment. So I'm going to step away. Sean is going to perform the test. His right leg is forward, so the instructions are simple, Sean. I just want you to slowly try to come down toward the board, return to the starting position when you're ready. Good, so I'm seeing good alignment. Come on up. And does his heel return? Good. So far I have him scored at a 2. He had a little waver in balance. This isn't easy to do. Let's go ahead with a second trial, Sean. Good. So good alignment. No waver in balance that time. That was a good test. I'm going to score him at a 3. That's a great test. So now we're going to go ahead and set him up for the other side. So you can step off briefly. And we're going to do the opposite setup here. So right foot on the line, yep. I'm going to help him balance. It's not easy to set up. Okay, but he is good to go. Feeling all right?
Yeah. Oh, yeah.
All right. So same test on the other side. So we're looking for any asymmetries. When you're ready, Sean, you're going to come on down just like you did for the other side. Good. So I'm seeing good alignment from the front. No waver in his balance. His heel returns to the starting position. He maintained good balance throughout that movement. Going to score him a 3. I don't need to see any more. That was a good test. So our next test is going to assess Sean's shoulder mobility. Basically what we're looking for here is the ability of his shoulder girdle, meaning his shoulder itself, as well as his scapula or shoulder blade, to move reciprocally, meaning one up, one down, combined with movements of his mid-spine or thoracic spine and also his rib cage. So this is more of a test, more than just a test of shoulder mobility. This is actually an important movement pattern for overhead athletes, pitchers, swimmers, volleyball players, something that we see, you know, in a lot of major sports. So basically what we're going to look for here, I've already taken a measurement of Sean's hand. If he gets within 1 hand length, we score him basically a perfect score of 3. Within 1.5 hand lengths, he gets a 2. Within or more than 1.5 hand lengths, he gets a 1. There's no pain with any of this testing. If there is, then he actually fails the test as he would with any of the other tests. That's an indication that he should get, whatever pathology or problem is underlying, he should get that checked out by a PT or a doctor. So we're going to have Sean turn around, and we're going to score this. We're going to start with the right side. So Sean, we'd have your hands in a tight fist. Your right hand is going to be placed on your upper back, your left hand on your lower back as far as you can go. I'm going to get my measurement here. All right, so Sean right there gets a 3 because he had about 5 inches. His hand length is 8 inches, so I don't need to see that test again. But we are going to do the same test on the other side. We're going to see what he scores. We're looking for any asymmetries here. So he's simply placing his hands on his spine. Really don't even need to measure this. He's within 5.5 inches again. So again, perfect score of 3 for each side. There's no asymmetries found. That test doesn't reveal any risk of injury as far as shoulder mobility is concerned for Sean. The next test in our series is the active straight leg raise. This is going to look like a test of pure hamstring flexibility, and that's only part of it. Basically what we're testing here is Sean's ability to move his limb through space in an unloaded position, but it's more than a hamstring flexibility test. This is actually a real test of core stability. So basically the movements are pretty simple with this test. I'm simply going to ask him to raise one leg at a time, as slowly as he can, return to the starting position. I'm going to mark with my stick here the distance he's able to travel with that moving lower extremity, and I'm looking for good alignment of not only the leg that's moving, but the leg that's down on the ground. Again, we're trying to find inefficiencies, asymmetries with movement patterns. The body has an amazing ability to make compensations. So, during the FMS testing, we're really trained to try to look for these subtleties in movements that might be compensations that could potentially increase Sean's injury risk. So we're going to take him through the active straight leg raise. Sean, what I'll ask you to do is we're going to start with your right leg, slowly moving it as far as you can, maintaining your knees straight, your ankles in that neutral position. When you're ready, go ahead and raise up slowly. Good, and back down. So what I saw there was his right knee wasn't able to maintain near full extension. Not terrible, but a little bit of a inefficient movement pattern. We're going to give him 2 more trials for that test. So again, Sean, when you're ready, we'll do second trial. Okay, and back down. Same thing I'm seeing there. The knee stays a little bit flexed, especially at the end range. So he gets 1 more try at this test. So when you're ready, Sean. Okay, good. And down slowly. So I'm on the borderline there whether to score him a 1 or a 2. What they'll teach us in the FMS course is if you're on the borderline, you're going to score him at a 1. He's always going to get the lower score. We're going to test the ability of him to do the same movement test for his left leg while keeping good alignment of the right leg on the ground. So Sean, when you're ready, we're going to do the same test for the left leg. Raising this leg up. The knee is flexing a little bit. You can probably see that. He's got good alignment of that other leg. Go ahead down for me, Sean. Good. You can see on his way down, he's able to straighten his knee back out. And when you're ready, trial number 2. Good. Knee is a little straighter now. Not able to move his limb quite as far when he straightens that leg. Go ahead down, Sean. So far he's scoring a 1 on this side. And last trial when you're ready. Good. Slight flex in the knee, not able to pass the joint line of the contralateral knee. Go ahead down when you're ready. So what we see there is a potential risk factor. Again, it's not just a test of Sean's hamstring flexibility, although there may be issues with hamstring flexibility. But ultimately, the hamstrings a lot of times will tighten up due to inefficiencies in the core. So this will be something we'll certainly be looking to clean up to, again, try to help him not only enhance his athletic performance, but minimize his injury risk. Our next test is the trunk stability push-up. This may look like a traditional push-up, and part of it is. It's not a test, however, of just upper extremity strength. What we're looking at is Sean's ability to engage his core, keep his spine in a nice flat position, basically core strength. So we're going to ask him to initiate the movement with his arms, but as he starts to elevate his body off of the ground, what I'm looking for is good alignment. I don't want to see his back sag at all. If I do see it sag, that represents, somewhat of an inefficient movement pattern. May have some minor issues with core stability. So we're going to go ahead and run him through this test, looking for any spine sag as he starts to initiate this movement. So Sean, when you're ready, instructions are simple. We're going to start this test. You're basically trying to do a push-up. You're going to initiate the movement with your arms, trying to keep your back straight and flat as you come up, and then you're going to return to the starting position. So when you're ready. Okay, so trial one, not effective at doing it that way. So the next step we're going to use is we're going to allow Sean to drop his hands now to the chin level. Basically try to make the movement a little bit simpler for him. It's still going to be a good test of his core stability, but again, we're looking for a good alignment as he tries to do this trunk stability push-up. So his hands are now at chin level. He's going to initiate the movement just like he tried to before. He's going to be using his arms to start and then engage his core as he presses his body right up from the ground. When you're ready, Sean. Much better. Good. And down. So that's all I need to see there. He wasn't able to do it with his hands at chin level, so we simply made that minor adjustment. A couple inches makes a big difference for him. He keeps good spinal alignment as his body moves through space. Score him a 2 on that one. A 2 is a good score. So our last test is Rotary Stability. What we're looking for here is Sean's ability to stabilize his core and initiate movements of the arm and leg at the same time. This test has its basic roots with creeping, which is part of our developmental sequence. So something that's very important with a lot of athletic activities, normal everyday movements, reciprocal movements of the arms and legs. So initially what I'm going to ask Sean to do is to try to move the left arm and left leg together, which is not very easy to do. We're basically going to ask him to move one arm out, same side leg back. He's going to try to meet his elbow to his knee directly under his body. As he does this movement, I'm looking for good stability, control, balance throughout the movement sequence. So Sean, when you're ready, we're going to start with the left arm and the left leg. You're going to raise the arm out in front of you. Your leg kicks out behind you. When you're ready. Okay, so very difficult to do. Lost his balance there, not a big deal. Small adaptation we're going to make here is we're going to ask him now to do it reciprocally. So he's going to move his left arm with his right leg, see if he can maintain good control, balance, stability throughout that movement. So when you're ready, Sean, we'll do left arm with right leg. So he's going to kick out that arm and leg. Good. He's now going to try to touch his elbow to his knee under his body. And he's able to do that. A little bit of spine flexion's okay. He's going to kick back out again, maintaining good control throughout this movement, and he returns to the starting position. So I would score that. We're scoring technically his left side because we score the arm that's moving. I would score that a 2. He wasn't able to do his same side arm and leg, but he could do opposite arm and leg and maintain good control throughout the movement. So now we're going to try to move the right arm with the right leg. Sean, when you're ready, same movement sequence there. Let's see if you can maintain control as you do it. Okay, good start. Thought he had it for a second, lost his balance. Again, not a big deal. So we're going to use the right arm with the left leg. When you're ready, right arm with left leg. Excellent, good. Let's touch that knee to the elbow directly under your body over the board. Good, and kick back out again. And back down. So that was excellent. What I saw there, I would score him on his right side as a 2 as well. He's able to keep good control, balance, stability throughout that movement sequence. Didn't find any asymmetries one side to the other, so there's no red flags with this movement screen. I think he's good to go for his rotary stability. To learn more about FMS, you can visit functionalmovement.com. If you're interested in having a screening, give us a call here at Capital Physical Therapy, 224-3511. Again, I think this is a very exciting movement assessment that can really benefit the public in general, athletes for sure. We're trying to minimize injury risk and ultimately enhance athletic performance. I think it's about time we did something like this, being proactive rather than reactive, not waiting until the body is hurt before we actually do something. Let's start before there's an injury that occurs and try to enhance performance and minimize your injury risk.